Let's talk about schizophrenia. Okay, so in schizophrenia, what happens exactly? Okay, what happens to the different tracks? That's what I'll be talking about. Okay, schizophrenia. Now, basically, we have got four tracks concerned with schizophrenia, four tracks in the brain: mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibulum tracts. Okay, these are the dopaminergic tracts, like they carry dopamine, which is a neurotransmitter. Now, in a normal person, guys, what is the level of dopamine in all of these tracks? Right? In a normal person, all of the dopamine levels in all these tracks will be normal. Now, when I talk about a schizophrenia patient, what happens is, no, schizophrenia is because the dopamine level, listen carefully, increases in the mesolimbic tract. The dopamine level increases in the mesolimbic tract. Okay, and this causes positive symptoms in schizophrenia. Now, what are the positive symptoms in schizophrenia, guys? These are delusions and hallucinations. Okay, now in mesocortical tract schizophrenia, what happens? The dopamine levels will decrease. Okay, and here in the other two tracks, nigrostriatal and tuberoinfundibular, the dopamine levels remain normal. So this is a change in schizophrenia. Basically, remember the first thing, this guys in mesolimbic tract, the dopamine levels increases, which cause the positive symptoms. Okay. Now, I told you in mesocortical, the dopamine levels what will decrease, and this is the reason of negative symptoms in schizophrenia. Tell me, what are the negative symptoms in schizophrenia, guys? It is anhedonia, evolution, then aphasia, right? Unkempt look. What does anhedonia means? The patient might have enjoyed doing something in the past, like playing hockey or badminton. Just an example, okay? But now in schizophrenia, during the time of schizophrenia, the patient will say that he is not interested in those activities which he used to enjoy once. Okay, so these are the negative symptoms of schizophrenia. Then another negative symptom is asocial, antisocial behavior, right? And aphasia, the patient remains very silent. Basically, if the patient has these negative symptoms, they say it's a bad prognosis. Okay, fine. So now what we did is, okay, so initially we wanted to treat this condition, and what happened is we just knew that in the mesolimbic tract the dopamine levels are increased. Initially, this is all that we knew about schizophrenia, so we came up with a drug to block the dopamine. Okay, we don't want dopamine to increase so much in the mesolimbic tract, so we came up with a drug which blocks the dopamine, and that drug is called as haloperidol. Okay, so it is a dopamine antagonist. Okay, so what does it do, guys? Yeah, it worked well in the mesolimbic tract. What did it do? The dopamine in the mesolimbic tract, it decreased, so the doctors were very happy. But what happened to the other tracts? Okay, it will decrease the dopamine. See, this haloperidol will decrease dopamine in all the tracts. Okay, but initially we were not aware of this fact, that in all other tracts, like in all other three tracts, mesocortical, nigrostriatal, and tuberoinfundibulum, also the dopamine will fall, right? And these will cause the adverse effects. Okay, so anyways, let's talk one by one. In mesolimbic tract, if the dopamine level has fallen, what happens to the positive symptoms of the patient? Positive, see, why do we say delusion and hallucinations are positive symptoms? That's because if the patient has positive symptoms, it is a good prognosis. Okay, it's better, it's easier to treat him, and he'll get out of the disease faster. That's why we call it as positive symptoms. Okay, so we gave haloperidol, the dopamine levels. What happened to the dopamine levels in this tract? Haloperidol, yes, it will decrease the dopamine levels, right? Yeah, so the haloperidol decreased the dopamine levels in the mesolimbic tract, and the patient's positive symptoms like delusion, hallucination improved, and we were very happy. But wait, what did it do to the other tracts? See, in the mesocortical tract, the patient's dopamine was already low, right? In schizophrenia, what we did, we gave haloperidol, which further decreased the dopamine levels in the mesocortical tract, right? So the patient's negative symptoms worsened. Okay, in the nigrostriatal pathway also, what happened? The dopamine levels fell, right? Now in the nigrostriatal pathway, you need normal levels of dopamine for the muscle relaxation, the proper movement of the eyeballs, for laryngeal stability and all. You need proper or the normal levels of dopamine in nigrostriatal pathway. But our drug decreased dopamine in the nigrostriatal pathway. So what will be the side effects, guys? What happens if dopamine decreases in the nigrostriatal pathway? The patient complains of sudden muscle contraction. There is going to be laryngospasm. There is going to be eyeball deviation. Okay, so a lot of, and also another important adverse effect that you got to remember here is acute dystonia. What is acute dystonia? Yeah, there is abnormality in the muscle, right? Then there is going to be akathisia. What is akathisia, guys? Akathisia means the patient is very restless. Okay, he keeps moving from one place to another. He keeps walking. He can't just sit at one place. Okay, so that these all are the adverse effects when dopamine decreases in the nigrostriatal pathway. Okay, fine. Now, in the tuberoinfundibular pathway also, what happened? Our drug decreased the dopamine levels. Now, this adverse effect is what, guys? Extrapyramidal symptoms the patient can get. Okay, so basically we actually worsened the patient's condition, right, by giving haloperidol. Now, this haloperidol was the first drug that doctors made against a mental illness during that time, and that is why it is called as first generation antipsychotics. Okay, first generation antipsychotics. Another side effect in tuberoinfundibular tract, which is very important, guys, that you should know is, see, in tuberoinfundibular tract there is dopamine and prolactin. Okay, now if one increases, the other decreases, and vice versa. Okay, now what did we do with the drug haloperidol? Haloperidol, if you give a patient, it decreases dopamine, right? It decreases dopamine. So what happens to the prolactin levels? The body will increase the prolactin levels. I mean, that is how the body works. When these both are inversely proportional. If one decreases, other increases. Okay, so we have actually decreased the dopamine in the tuberoinfundibular tract by giving haloperidol. The body will increase prolactin. Okay, as a reaction to that, it will increase the prolactin levels in the body. The body itself will increase the prolactin levels. Now, when prolactin levels increases, what happens? Tell me. Yes, the patient can have galactorrhea, right? The patient can have decreased libido. The patient can have impotency and gynecomastia. So these are the side effects of haloperidol. Okay. So basically here what we did, guys, we wanted to treat the patient of schizophrenia. We gave him haloperidol, and in fact we increase the symptoms of a patient. Okay, that's the worst thing we can do to a patient. No? Okay, now, but during initial times we didn't have much idea about why the schizophrenia happens. Now what happened? One day what happened is there in the hospital a patient came, okay, who was LSD abuser, and he showed schizophrenia like symptoms. Okay, so as a general protocol, what these doctors did, they checked his urine sample also. Okay, fine. So he had schizophrenia like symptoms, and the doctors checked his urine sample, and they found that in the urine the serotonin levels were increased. Very important, the serotonin levels were increased. Okay. Now, what they did is, when a schizophrenic patient came to the ward, they checked his urine also, and they found the same thing, that is, serotonin levels have increased. And so now they have made a new discovery that not just the dopamine levels, even serotonin levels were affected in schizophrenia. Okay, and that changed the way we treat the schizophrenic patient. So now we understood that schizophrenia, the main problem is that the dopamine levels are high. Okay, also the serotonin levels are high. Okay, Now, what we did is we found or made new drugs which not only blocked the dopamine but which blocked serotonin also. Okay, so these kinds of drugs, I'll tell you the drug's name. Such drugs are called as atypical or second generation atypical drugs or atypical antipsychotic drugs or second generation antipsychotic drugs. Okay, why we say second generation? Because the first generation drugs like haloperidol, they blocked only dopamine. Okay, but later on we found that even serotonin is increased in schizophrenia, so we came up with drugs which decrease both the dopamine levels and serotonin levels in the body of a schizophrenic patient, and these drugs are called as second generation drugs or atypical antipsychotics. Okay, so can you tell me some examples of second generation or atypical antipsychotic drugs? Yeah, yes, clozapine, right? Clozapine, then risperidone, then aripiprazole, and olanzapine. Very clear, no? Fine. Okay, here you have a code to memorize the atypical antipsychotic drugs, which is COSRAC. Okay, tell me, what is it? COSRAC. Okay, what does C stand for? It is clozapine, olanzapine, ziprasidone. R is for what? Risperidone. A is for aripiprazole, and Q is quetiapine. Okay, I'll tell you how it works, guys. Just okay. When we give, let me take a different color. Yeah, when we give, let us say, the second generation antipsychotic, let's say clozapine. Okay, we give clozapine. What happens to each tract? Let us see. So yeah, just see this schizophrenia. What happens? The dopamine levels are increased. What does clozapine do? It will decrease the dopamine levels, or it will bring back the dopamine levels to normal. Okay, normal range. And here in the mesocortical tract, what does clozapine do, you know, guys? In a schizophrenic patient, the dopamine levels has decreased, right? So the clozapine will make it to normal. Okay, in fact, it can slightly increase the dopamine levels in the mesocortical tract also, because you know this clozapine, or as a matter of fact, any second generation antipsychotics, they have this partial agonist action at the D2 receptors. Okay, so they can slightly increase the dopamine levels also in the mesocortical tract, and here also nigrostriatal pathway, it will bring the dopamine levels back to normal. In the tuberoinfundibular pathway also, it will bring the dopamine levels back to normal. Okay, so one final point, if somebody asks you what is the drug of choice in a case of resistant schizophrenia, okay, no matter how many drugs you give, the patient is not improving. Okay, there's a criteria for that. Let's learn it someday later. So just remember, if somebody asks you what is the drug of choice for a case of resistant schizophrenia, you must say it is clozapine. Okay, clozapine. But one side effect with clozapine is that it causes weight. I mean, it increases weight. Okay, weight gain is one of the important side effects of clozapine. All right. Now, even when the clozapine is not working, okay, finally the final choice you're left with is ECT. Okay, electroconvulsive therapy. Now, two more points, guys, about clozapine. See, what is another important side effect of clozapine? Before giving clozapine, you have to do a blood test. Okay. Now, can you tell me why? Before giving clozapine, you have to do a blood test. Tell me why. What is an important side effect of clozapine? Yeah, the patient can get agranulocytosis. Agranulocytosis, very important. Okay, this drug, it can cause destruction of WBCs, especially the neutrophils. It will destroy, and that causes agranulocytosis. So if the patient's WBC count is less, do not start him on clozapine. Okay, because it will further decrease the WBC count. All right. Then it can cause seizures and some heart problems like myocarditis. So these are the problems of clozapine. All right, that's it. Have a good day. God bless you.